Hello friends, I'm Dr. R. K. Duva. I welcome you to my channel, and in my series Know Your Disease and Remain Comfortable, I will talk about high blood pressure, that is known as hypertension. Before speaking on hypertension or high blood pressure, I just want to ask one question. So suppose you have a balloon and you keep on inflating that balloon with water or any fluid. So what is the limit? So there must be some limit or the capacity of the balloon beyond which that balloon will burst. Suppose if I am recording here in a studio, I am inflating the balloon, and if that balloon burst, what will happen? So that fluid will spoil my clothes, spoil my equipment, and that equipment may be not usable at all or irreparably damaged. So that equipment can be easily replaced in a month, 5 days, 10 days, depending upon your requirement and your financial condition. So the thing that I want to say is that we value those things that we can purchase with money. We don't value the things that we cannot purchase with money, or you can say the things that comes to us as a free. So what are those things that comes to as a free and we don't value those things? These are our parents, brothers, sisters, our relations, our friends, our mind, our thinking, love, so our creativity. So all these things comes as a free. Our body is also free. So the main purpose of telling all these things is that we don't value our body also, because it comes to us free. We care too much about our new car, nobody should scratch that car. But do we value our body? Probably not. So what I want to say is that if you have been diagnosed as a patient of hypertension, that means you are having high blood pressure persistently on many occasions when you get your blood pressure checked and it remains high. Over that, you are also having symptoms of high blood pressure. You may be feeling uncomfortable, you may be having giddiness, blurring of vision, severe headache. So all these are the common symptoms, and many patients get to know that now he is having high blood pressure because he knows that these kind of symptoms are produced when he is having high blood pressure. So when you have already consulted and the physician has prescribed you some medication, and you have to take that medication on a regular basis. But many times what you people do, or we all do, that when we feel that now the blood pressure is under control, we stop taking medication. Again the symptoms appear, then we think that it is these symptoms may be because of high blood pressure, and we again start taking the medication for 15-20 days, and then we again stop the medication. So this cycle keep on going. So until one day that free precious gift given to us by the nature or God, that is our brain or our eyes or any other organ, becomes damaged. That is mainly because of our own carelessness, our own foolishness. So now let me tell you how all these things happen. As you know, all these, you can say the blood is circulating in the blood vessels. When because of many reasons blood pressure keep on increasing and increasing, and ultimately the increase to certain level that it starts producing symptoms. So when it starts producing symptom, that means that blood pressure is putting too much strain on the blood vessel walls. Many times these blood vessel walls of brain and eyes are very thin walled, and sometimes at weak points they bulge out, and these bulging of the side wall of the blood vessel is known as aneurysm. You must have seen in a cycle tire or car tire tube that when we are inflating and there is sudden bulge from the side wall of the tube. So that is the weakest point. So what happens when there is fall in the blood pressure or normal level of the blood pressure is reached with the medication and we again stop, and this process keep on 2 3 4 times. So we are not taking care of our body, and ultimately one day the blood pressure increased suddenly to such a high level that one of the small vessels, artery of our brain or eye or any other vital organ gets ruptured. So as you know, our brain is just a jelly like structure and it is enclosed in a very thick hard skull. So there is no scope of expansion of the skull. So what happens when there is rupture of the blood vessel? The blood keeps on oozing from that blood vessels and keep on accumulating into the brain. So what will happen? There is no scope of expansion of the skull, and the blood that is coming out of the artery will keep on pressing the brain. So that pressure over the brain will keep on increasing, and the part of the brain that is being compressed by the increasing volume of the blood, so the symptoms will be produced according to the area of the brain that is being compressed. So suppose the speech area is compressed, so in that case the person will not be able to speak properly or may not be able to speak at all. If some motor area is involved, in that case the person may not be able to move his or her limb, upper limb, lower limb. So by this the things develop. Suppose such kind of rupture if takes place in your eyes, there will be detachment of the retina, there will be blurring of the vision, there may be many other shadows keep on floating in front of your eyes, or there may be sudden loss of vision also. Similarly, that things can also occur in your liver, you can say the kidneys. So continuous high blood pressure keep strain on your heart also. Chances of having heart attack, you can say the infarction of the heart muscles, the chances are very high. So ultimately the high blood pressure is putting strain on all the vital organs of the body. So our main role is that we can just modify our lifestyle, our food habits, eating habits, and take regular medication, and do regular exercise. So we can control our blood pressure, and simple taking one or two medication a day, if we can control our blood pressure, so what else that we want from our body? So by simply taking a medication on a regular basis as prescribed by our physician, we can keep our body fit and fine. Over that we can, many times that physician says that now he is decreasing the dose of the drug or the medication for blood pressure, because we have changed our lifestyle, we are regularly doing the exercise, so we have changed our food habits also. By doing all these things we can increase our lifespan also, we can make our life more comfortable, and by doing this we can save our the most precious organ, that is the brain given to us by the nature. So my simple request is that follow your instruction given by your physician, have regular exercise, and change your lifestyle and change your dietary habits. By doing all these you can decrease or keep your blood pressure under control and remain a comfortable person. Thank you very much, and don't forget to share and subscribe my channel to know many such things about your body and your disease in future also. Thank you very much.